Today we are going to start a new chapter that is respiratory system. So basically, in previous class we talked about immune system, lymphatic system. This is very important and which is responsible to protect our body, which is responsible to defend our body, which is responsible to increase the mechanism of any organ. Okay. So next chapter is we have respiratory system. So basically respiratory system is another important chapter because for every function we need two things. Two things are very important if we want to live. Okay. One is oxygen, not only oxygen, intake of oxygen and outgoing of carbon dioxide. Okay, this is the first thing. And second thing is glucose. Glucose and oxygen are the two important factors which is responsible for any mechanism in the body. If there is no oxygen, there is no production of energy. If there is oxygen but there is no glucose, there is no production of energy. So there is no energy, no function of the cell. There is no function of the cell, the patient is in dead state. So that's the reason we need a system to take the oxygen from outside environment and it will reach to the cell by the help of circulatory system and the oxygen is utilized by the cell. And we need one system which take the unwanted substance from the cell, that is main is carbon dioxide, from the cell to the respiratory system, to the circulatory system, from the circulatory system to the respiratory system, from the respiratory system to the outside environment. So basically, this is the connection of three systems. One is respiratory system, one is circulatory system, and third is any cell which is functionable. It may be nervous system, it may be endocrine system, it may be own respiratory system, it may be own circulatory system, it may be urinary system, reproductive system, integumentary system, any system. So we need two systems. One is the importance of to take the oxygen, one is to circulate the oxygen, and third system is utilizing the oxygen. So basically, we want to know about respiratory system. In the respiratory system, we have nose, nasal cavity, pharynx, larynx, trachea, bronchial tree, lungs, pleural membrane, alveoli. So how we inhale, how we exhale, we will talk about, and pulmonary volume, how much amount of oxygen is coming, how much amount of carbon dioxide is going, and transport of gases in the blood. So this is the gas oxygen. So how the blood take the gas and it will wait for the cell, and how the circulatory system is continuously working. We have two mechanisms, that is nervous mechanism and chemical mechanism, and how the acid base balance is happening because when the gases exchange occurs, we need acid base balance. All we will discuss in this class, and we have boxes also, asthma, but whatever the important thing we will discuss here, mainly asthma and pneumonia. These are the most common diseases that we see in our community. Okay, so let's start. Basically, I introduce everything about respiratory system. Here, the introduction part. We will something. Sometimes a person will describe a habit as being as natural as breathing. Immediate, what could be more natural? We really think about breathing, and it's not something we look forward to. We might look forward to good We just breathe usually at the rate of 12 to 20 times per minute. When exercise, the breath is increases when there is no necessary flow. So we will breathe very lower side. So basically, the important things. Okay. So for in the 1 minute, how much time? How much times we breathe? 12 to 20 times. Okay. So basically, uh, this is the respiratory system. Okay. It's starting from here. So one type of respiratory system is that, and second is this is the upper part of respiratory system, and this is the lower part. You can tell it upper respiratory tract and lower respiratory tract. Let's start with the divisions of respiratory system. The divisions are two types. One is upper respiratory tract and another one is lower respiratory tract. What are the upper respiratory tract consists? One is nose, nasal cavity, pharynx, larynx, and upper trachea. So let's see. You can see that this image, nose, this is the nasal cavity, larynx, voice box, trachea. Okay. So these are the uh, upper respiratory tract. Okay. We will discuss in detail. Pharynx also is there here. The pharynx here. You can see here. Nasopharynx, oropharynx, okay, laryngopharynx. Okay. This is the sorry, oropharynx, nasopharynx, and laryngopharynx. So complete is called pharynx. We'll discuss in detail. So next is lower respiratory tract, which have trachea, lower trachea, okay, lungs. In the lungs, we have bronchial tubes, alveoli. So these are the lower respiratory tract. So in the pleural membranes, respiratory muscles, diaphragm, intercostal muscles, these are the coming in lower respiratory tract. So basically, according to electrohomeopathy also, we have petorial group. Okay, which works on one and only respiratory tract of respiratory system. We have P1, P2, P3, and P4. These are the original remedies. And after we have P5, P6, P7, P6, P7, P6, P8, P9 are compound remedies. Okay. So basically, you have P1 to P4 original remedies. So basically, P1 work on upper respiratory tract. So whenever you have infection, what type of problems? Is the problem in the nose, problem in the nasal cavity, problem in the pharynx, problem in the larynx, problem in the upper trachea. You can advise the patient P1. Along with P1, you can add P2. Okay. P2 also work on the upper respiratory tract infection. But mostly P2 is working lower respiratory tract. If the patient have both infection, you can advise P1 and P2. If he is children and women, P3 works very well. Along with P1, if it is an upper respiratory tract, give P1. If it is lower respiratory tract, give P2. Along with, if you add P3, it will work on children's and relatives very well. And P4 for old age and those who have chronic respiratory tract problems like asthma, like TB, pneumonia, pleural effusion, emphysema, etc. etc. Okay. So this is also uh, thing about electrohomeopathy also we want to know. So here very detailedly we given. So that is the reason I discussed about petorial group. Now we talk about nose and nasal cavity. Very, very important because nose where we breathe the oxygen from the nose. So this is the initial part of nose. And we have one thing about tell about in the acupuncture also, we have lungs very important. Lungs and large intestine are very, very important. Lungs have the chi. Okay, it will have chi, which circulate, and it will, what it can do, it will purify the chi. It will add oxygen from the environment to the chi. Okay, so very, very important in uh, acupuncture, and it is, I think it is metal, na? Metal element. Yes, am I correct?
Yes, sir.
Okay. So metal element, lungs and lung intestine. So according to acupuncture also, it is very important. According to electrophysiology, lungs are very important. According to physiology also, lungs are very, very, very important. Okay. So there's the reason we want to know about that. So let's talk about nose and nasal cavity. So air enters and leaves the respiratory system through the nose. So I told you that nose is the first entrant gate of oxygen, okay, which made bone and cartilage covered with skin. Just inside the nostrils are hair, which helps block the entry of dust. So basically, nose is starting from here. This is the nose, okay. This is the nose. Basically, this is starting from here. And this is the nose. We have the beautiful nose. And actually, one more thing I want to tell here, electromyopathy. With the nose, you can see the patient belongs to which temperament. So here we have two types of nose. One is like that parrot nose. Okay. One is like that. Okay. In that, if it is parrot nose, there is a sharp edge. Okay. There is no sharp edge. Okay. And one thing is here you can see the slope. If it is the slope, direct slope, or it is deviated, so what we can tell is belongs to temperament of ceremony. It is belong to lymphatic temperament. Okay. So in detail we will discuss electromyography, but here the nose topic here, because the reason explain here. So with the nose, I will able to know the temperament of the patient also. So this is the nose. In that we have first you have hairs here. Okay, in the nostril. This is the nostril area. Okay, nostril area we have small holes. Okay, in that area we have hairs. Why does we have hairs? Because to protect the entry of dust from the environment. Okay, and we have two nasal cavities. I told you that are within the skull, separated by nasal septum, which is a bony plate made up of ethmoid bone and blubber. Okay, so basically, I think this image is not going to reflect everything. So let's see in detail nose anatomy. So you can see that. So this is the nostril. On here we have the nasal cavity. You can see this is the nasal septum. This is the nasal septum. So from which substance it is made up of? It is made up of ethmoid bone and mucosa. It is a bony plate. Okay, this is divides from one nostril to another nostril. Okay, so very important nasal septum, which have it will be straight. Some patients have nasal septum deviation. So this is if it is the nose, it is the nasal septum. I think it is the nose example, not beautiful nose. If it is straight, this straight, so doesn't have problem. Okay. If it is in some patients have like this curve. What will happen? They have breathing difficulty in one side. The mucus is uh, here locked by the mucus, so the entry of air is difficult. So we have to able to take the air from the one nostril. Okay. Next we have nasal mucus. So here we have nasal mucus. It is made up of ciliated epithelium. Here we have goblet cells which produce mucus. So here you have mucus, nasal mucus, because it is the nose, we will call nasal mucus. We have cell. Which cell? Goblet cell, which produce mucus. Three shelf-like or scroll-like balls called conchae project from the lateral wall of each nasal cavity. So here you can see that they are the projections. Okay, these are the, because the entry of air will happen easily. Okay, so that's the reason we have conchae. This is the superior, this is the medial, and this is the inferior. So we have nostril, we have nasal cavity, we have nasal septum, we have conchae. Okay, these are the things very important to us to know. Just as shelves in a cabinet provide from flat space for storage. So I told you that because of to increase the storage capacity of the air, so that's the reason we have conchae. The concha increases the surface area of nasal mucosa. As air passes through the nasal cavity, it is warmed and humidified. So that air that reaches the lung is warm and moist. Bacteria and particles of air pollution are trapped on the mucus. The cilia continuously sweeps the mucus towards the pharynx. Most of this mucus is eventually swallowed, and most bacteria present will destroyed by the hydrochloric acid in the gastric juice. So whenever we breathe, some dust will come. So what will happen in that area? The mucus is present, nasal mucus. So it is reached to the pharynx area, and eventually we will uh, spit it, or sometimes we will swallow it. After swallowing, it will enter into the esophagus. After entering into the esophagus, you will enter into the digestive system or stomach, but it killed by gastric juice, that is hydrochloric acid, because it is acid. Next, we have in the upper nasal cavity. So, in the nasal cavity, what will you have? Olfactory receptors. So, very, very important. Here we have the olfactory receptors. You can see here in this image, the picture is clear. So, this is the olfactory receptors above the superior concha. So, where are the olfactory receptors are present? Present in the superior concha. What are olfactory receptors? For smell, beautiful and a very tasty smell we smell. After that, we want to eat the food. Okay. So because of the olfactory receptors are there. So whatever the chemicals present in that air, we will be able to smell. The olfactory nerve goes to the ethmoid bone to the, okay. These sinuses are lined with ciliated epithelium and the mucus produced drain to the nasal cavity. The function of the paranasal sinuses are to lighten the skull and provide resonance, more vibrating air for the voice. So basically you have sinuses already discussed, but I want to repeat it. You can see that in that image. So here we have beautiful sinuses are there. Here we have the frontal sinus. This is the frontal sinus. Very important. Next, you have ethmoid sinus. These are the ethmoid sinus. This is the maxillary sinus. Okay. And in the side, we have sphenoid sinus. So most of the patients are, suffer from maxillary and frontal sinus. They say they will tell have very heaviness in that area. Have heaviness in that area. So they will try to uh, massage that area, because due to that massage, the mucus will release from that area and coming to the nerves. So even though during this I think you listen or not. Number of children, number of adults suffered from viral infection nowadays. Okay. So the pattern of the disease is like that. First, they have body pain, then they have cold, then they have cough, then after they have fever. So I saw a number of patients. The pattern is like that. So after controlling of the fever, they have headache, only one side headache because of the cold. The sinus, one side sinus is inflamed. So lots of the mucuses are stored here. They are unable to come outside. Even I am also suffered from this type. I have right side headache. So for after relieving from the fever, I have 4 to 5 days. I had a headache. Okay. So basically, this is the pattern. So we can advise electrophysiologists along with ideal acupuncture also. So it gives me very good wonderful result. Okay, now I am very healthy. Okay, with the confidence. So we have sphenoid sinus is there. This is the maxillary sinus. This is the frontal sinus. So whenever a patient came to a clinic with sinusitis, you have to touch it area, yeah, press that area, and you will check that what is there any difference in of this sinus? Okay, is there any swelling? Is there any pain or redness? Okay, check that. Because of that, they have sneezing, irritation, headache, running nose, running watery eyes, because they are related to each other. Uh, they are connected to each other. Okay. So this is the important of sinus. So we have sinuses. So because why we have sinus? Because whenever we talk, the air in that area will truly rotate. Okay, and second thing is that to maintain the head space or head weight, because of the sinus only, our head is very we are unable to uh, think that it is very heavy because we have in the brain is also heavy. We have skull which is heavy, but we are unable to see the heaviness. When the sinuses are blocked, we will feel heaviness because the air cannot pass, the air cannot come from one nostril to another nostril. Now the air is circulating. So those are because of the sinus only, our head is very little in weight. Okay. Next, we have pharynx. So understood about nose and nasal cavity. Very, very important because whenever a patient came to the clinic with sneezing, with running nose, so you have to examine all this. You have to see the nostrils, you have to see the nasal septum, you have to see the nasal cavity, you have to see the conchi, you have to see the olfactory receptors. All you have to see and the sinuses. After examination, only you conclude which area is having problem. Okay. So, and one thing you have to understand here, olfactory receptors during COVID-19, number of patients are suffered from loss of smell. Why does happen? Because after entering of the virus attack the olfactory receptors. Some patients, the olfactory receptors are damaged permanently. Now also they are not having smell, unable to smell. Some are temporary, some are sometimes it cannot affected this area. Whoever lost the smell, these adults have severe COVID. I remember most of the people because the COVID attack direct here. So here the COVID infection multiplied, it unable to enter into the respiratory tract. So it attack on the upper respiratory system. Sometimes it will not attack to the olfactory receptors. It directly enter from nostril to the lower respiratory tract. So those who have lower respiratory, they started with lower respiratory tract infection. So they are suffered very lot. Even though I am also suffered with COVID, but my First symptom is loss of smell. After that, I had fever, body pains, cough, all those symptoms I had. Okay. So these are the things we have to know about that. Now we talk about pharynx. So we have pharynx. The pharynx is a muscular tube posterior to the nasal and oral cavity. So this is the nose. We have the in the back side of the nose we have pharynx. This whole area is pharynx. If it is related to the and oropharynx, if it is to it is behind the nasal, we can call nasopharynx. It is behind the pharynx, we have laryngopharynx. Okay, so that's the reason we have named it. We have nasopharynx, oropharynx, and laryngopharynx. So first is nasopharynx, which is behind the nasal cavity. I told that if it is behind the nose, so we will call nasopharynx. The soft palate is elevated during swallow of along the nasopharynx and prevent food or saliva from going upper rather than down. The uvula is the part of the soft palate you can see at the back of the throat. The posterior of the nasopharynx is adenoid and or pharyngeal parts. So basically here we have understood one thing. During swallowing, we have one thing that is soft palate. Here we have the soft palate and we have uvula. So what will they do during swallowing food? It is, and we have epiglottis. Okay. So this will cover that the food could not enter into the nose area, nasopharynx, and it will enter into the esophagus. Okay. And there is the link we have to understand. Right? We have here we have the at the oropharynx, we have the number of things like tonsils, tonsillitis already, I think we discussed, not discussed. Let's see about the tonsillitis. So we have number of tonsils, you can see that pharyngeal tonsils, here we have tubal tonsils, palatine tonsils, and lingual tonsils. So they will protect our protect from bacteria. Mhm. Four types of tonsils are there. Lingual tonsils, palatine tonsils, tubal tonsils, pharyngeal tonsils. Behind the pharyngeal, we have pharyngeal tonsils. Behind the tubal tonsils, we have tubal tonsils. Here we have beneath pharyngeal tonsils. Here we have palatine tonsils and lingual tonsils. Here we have the adenoids also. So let's come back to the topic. Here we have the adenoid or pharyngeal tonsils, also called this is the adenoid or pharyngeal tonsils, a lymph node that contains macrophages. Here we have that is a nodule. Okay, nodule. So what nodule have? Nodule have macrophages. What macrophages do? They will eat the bacteria and bring that bacteria to the lymphocytes. So there's the reason macrophages, whenever bacteria enters, they will swallow. Sorry, they will swallow and become inflamed. So that's the reason we are unable to swallow. So that's nasopharynx have two tubes, ecostean tubes. Okay, please listen very carefully because it is very important. Two ecostean tubes which extend to the medial cavities. So here we have extrusion tubes which will enter, which will which will open into the ear cavity. So what is the purpose of extrusion tubes? Is to permit air to enter or leave the middle ear. So the whatever air is present, it will release from that area. Okay, this is the use of extrusion tube. allowing the eardrums to vibrate properly, and as well as to vibrate the eardrum. Okay, so whenever we swallow some things, or we put nostril drops, or we put ear drops, what will happen? We are able to uh, we will able to have some sort of chemical in our throat because of that ostian tube. So whenever we have throat problem, so what will happen? Our ear blocks. So whenever sinusitis, the patient have ear blocks. Because of the ecostean tubes is blocked. So there the reason ear cannot pass the air properly, and drum also cannot ear vibrate properly. So that's the reason the ears are always blocked. Understood? Next, our nasopharynx. Nasopharynx is passage of air only, but the remainder of the pharynx serves as both in air food postulation, although not for both at the same time. So you cannot eat food one time, you cannot do the airs one time. So when we are eating some sort of, the air is cannot enter into the lungs. So this is happening. So we have okay, good nasopharynx. Now we have oropharynx. Oropharynx is beneath the mouth. So this is the mouth. This is the oropharynx. Its mucosa is stratified squamous epithelium, continues with the oral cavity. On its lateral walls are palatine tonsils. So here we also have tonsils that is made up of lymph nodules. Together with the adenoid and lingual tonsils on the base of the tongue, they form a ring of lymphatic tissue. So basically here, uh, palatine tonsils, we have beneath, we have lingual tonsils, we have oropharynx or adenoids. All this will become make a circle like. Okay. To to protect from all area. First, which is mouth cavity is very big. It will come from the nostril, it will come from the mouth, from any area, it will protect. Next, we have laryngopharynx. This is the most inferior portion of the pharynx. It opens anterior to the larynx and posterior to the esophagus. Contraction of the muscular wall of the oropharynx and laryngopharynx are part of swallowing reflex. So here, connection laryngopharynx is from that area we have forwarded. Forward we have trachea, backward we have esophagus. So this is all about pharynx. Next we have larynx. So we will discuss larynx tomorrow. Okay. Anyone have any doubt? Can ask.